Hey guys, Don here. Welcome to the $1,000,000 Minute. This is helping you get your practice to the $1,000,000 mark and beyond. I just got back from Brazil. I was there for a little trip, and it was a nice trip. We had a nice time. It was a nice flight. I preferred the flight there. So if you're ever going to go to Brazil, there's a day flight, which I think is better than the night flight, because the day one, yeah, you kind of waste a day, but it's a lot easier than the night one, because the night one I have a hard time sleeping on the flight. When I got back, I was off Monday, and then Tuesday was a half day because we had a kind of a holiday party with the staff. We brought them to a place called Apex here in Marlborough, nearby, and we played go-karts, which I kind of got sick last time I rode the go-kart because we were a little too intense, a little too competitive with the doctors. And then we bowled and ate a whole bunch. We had a little kind of a gift exchange, and so it was good. It was a good time. But that day, a few things that I saw was another patient that came back for another ganglion that came back again, and I did a level 3 office visit with an aspiration of the ganglion. We talked about surgical fusion of the DIPJ, but I try to avoid that because just a kind of an intense surgery for just a little ganglion. We've removed it twice, and he's using Coban around that, so we purchased 1-inch Coban on the way out. Another patient came in for EPAT number 1, actually a plantar fascia follow-up, and did an ultrasound, and then she decided on shockwave number 1. We set up number 2 and number 3. Also had a post-op patient that came in, got x-rays for bunion and Taylor's bunion. She's doing well. I'm going to do a 4-week follow-up for her. Another patient that came in for an x-ray, and this patient had a pain in the sinus tarsi region. She also did have equinus that could have been contributing to it, so we did cortisone. This was cortisone number 2. Cortisone number 1 helped, covers number 2, and we're going to do the Pelto special, so night split and foam rolling and morning stretch. And then she'll be back in 2 months. Another patient that came in just for nails, 3-month follow-up on my Friday morning time that I do the routine care. I only do routine a half day a week. That seems to work best. We all kind of just double book and put them all in there. I did scar laser number 3. This was that patient that had a brachiomet surgery by another doctor, and the digit was slightly plantar flexed. I stopped at 3. I tried 3. I thought it was going to soften things up. It didn't really work enough. I guess maybe I could have tried shockwave for her to loosen it up. But really, I think she just needs the capsule opened and the McGlamory to kind of free up things there, but she's not really willing to do that right now. So I'm not going to do any more scar. I'm not going to see her back. Another patient that came in had a injection to the navicular tuberosity region for a posterior tibial tendon, doing much better. So that was just an office visit, no follow-up. Also a patient that came in for a lot of really bad midfoot arthritis unilaterally, and possibly Charcot changes. So I did get an MRI for this patient, so I'll see her back after the MRI. Another patient came in for a 4th web space maceration. He'd already been on antibiotics. The redness came back, put him on antibiotics again, and then I kind of debrided it because there was some maceration in there, and it showed a little bit of a pinpoint ulcer, so I used an ulcer debridement code for the procedure. Another patient came in for a diabetic foot exam, and I did that. See them back in 3 months for routine. Another routine kind of snuck in there, maybe because I was on vacation for a few days, so I did that. And then there's also an ulcer noted to the second toe, the tip of the toe. It's been there for 2 years with cracked skin, kind of a bulbous change at the tip. So I was kind of thinking osteo, so we got an MRI for that patient. And then finally, the last patient was a Lamisil follow-up. Okay, so that was kind of what we did. It was a good time for the staff and for everyone. And I'm going to go right over and the next day because I had just going to put 2 days here in one. This was kind of a neat day. This was my Wednesday. In the morning, I had coffee with a CPA and a financial planner. This CPA guy was a member of Strategic Coach, and so he's a big reader. Prior to meeting them, I always like to research people, so I looked him up. I bought this guy's book. He has a good book, some marketing tips, but really the main marketing tip he said to me, he says, Don, you have to email everyone once a week, which I do, but he does a quarterly, actually print newsletter. And my main restriction to that is like, gosh, there's so many patients we have, and do I do patients? Do I do referral sources? I started that and I kind of gave up. I don't know if anyone else has a great success on that, but he said that's really key. This brings in a lot of business. I was thinking maybe sending it to referral sources, and then largest check patients, like patients that we want more of. So, for example, shockwave, Swift patients, orthotic patients and only do those patients. That might be a better way, and do everyone in like the last year. That was a good thing. So I got some good takeaways from him, also of doing like a kind of a mastermind. And then during lunch period, that Alleviate company came back again, and they did an instructional for my staff. So we're going to start selling Alleviate. So kind of the thought is everyone that would typically get a night splint in the past, now they're going to be getting this Alleviate, which is like almost like a Graston technique for the back of the calf and the foot. Has a compression socks, and it also has a stirruped kind of almost like a way of taping the foot, but using a stirrup on a little ankle brace type of thing. It's going to be $215 for the kit, and the thought is, so instead of doing the foam roller for $35, we're going to have this for $215 for the patients that'll accept it. I'll let you know kind of how it goes. Okay, so back on Wednesday, this is my shockwave day, so I did a number of shockwaves. Number 2 was on plantar fasciitis, the 5th one on the 5th med head, the 3rd one on the 1st med head. That 3rd one will be the last one. That'll be 6-week follow-up. I did a nail sample visit. I took a nail sample. They'll be back in 3 weeks. A patient that came back for some 2nd and 3rd metatarsal base fractures, and I was a little concerned about possibly a Lisfranc injury, so I'm going to get an MRI for that patient. Another patient that came in with sinus tarsi pain, doing better. Another ulcer. This patient for an ulcer and gait evaluation. He has an ulcer between the toes. He was getting an orthotic, and he had neuropathy bilaterally, so I really kind of told him to be careful with that because of the neuropathy. Another patient came in for after getting a wart removed, and another one had a porokeratoma, so I retreated those with lesion destruction, and she'll be back in 3 months for routine care. Also, a patient that came in had a lot of foot pain and edema, and I was concerned about her circulation, so I sent her for a vascular, because maybe it could be a venous issue. Another patient came in with a number 4 EPAT. Number patient came in for a fracture follow-up of a 3rd toe. It was kind of a comminuted fracture, so it's just going to take a little bit longer. Just reassured the patient. Lamisil follow-up, another ingrown toenail patient where I did a IND. EPAT number 3, EPAT number 2. Another patient came in for right foot pain with kind of like posterior tibial tendon dysfunction. And then finally there was a patient that came for an orthotic follow-up. This was a patient that she kind of has a big limb length discrepancy, so we added it to the orthotic, but the orthotic wore out in the front because of the big heel on it. And she's still kind of rolling out to the side because of the cavus foot. So I'm thinking she's going to do better with an AFO. So we're checking on that. The challenge with AFOs is getting them covered. Like she's going to have a 30% she's going to pay, and then she has to determine if it'll be covered by insurance. If the rest will go towards the deductible. And the last one was a orthotic patient that came in, paronychia follow-up, and he got an orthotic. So anyway, that's the day. Let me know how things are going. If you want to learn more or any questions, shoot me an email, Don at Podiatry Practice Mastery. Thanks.